Hi everybody, this is Matt. We're continuing our series on the peripheral vascular system, and we are moving on to the circulation of the brain. Talk about something important. We left off at the aortic arch, and from the aortic arch we had the internal carotid arteries that bring oxygenated blood to the brain. And I won't go into any great detail because the vasculature of the brain in detail is a subject all unto itself, but I wanted to again make use of these wonderful depictions and actually pieces of artwork in Functionelle Anatomie aus Berlin, from Berlin. And anyways, I'd like to thank them for their work. They did a great job. So anyways, here we have the base of the brain, and if you look closely really at the front, and I'll focus in on it right there, you will see the opening of the internal carotid artery, and that is the start of the blood circulation of the brain. And then it branches off to go to the back of the brain, and we will have an additional presentation to show you how refined and fine in terms of the diameter of the vessels it gets with time, or as it branches off into smaller and smaller segments of the brain. And that is very nicely presented here. If you look down at the base of the skull there, again, you'll see the internal carotid circulation, and then it rises up through the skull into the brain and branches off to each area of the brain, and they get smaller and smaller in diameter to the point where they reach the surface of the skull, the internal surface of the skull. And you can imagine the importance of not having blood clots go to your brain, or emboli, for instance, plaque from your carotid arteries. That very easily can block off small vessels especially, but even larger vessels, because even the largest vessels are not that huge in the brain. So that is quite an impressive presentation there as well. And lastly, just to give you a really good idea of how small the vessels get, this is a presentation of the eye. And just look at how small the vessels get. Those are the arteries at the back of the eye. If you look closely there, can you imagine how small a blood clot it would take to block those off? Very, very small. And I'll back out slowly. And just keep in mind the essential nature of all your senses. Imagine that because of a blood clot you can't see anymore, or hear, or taste, or feel things. You really want to do all you can to minimize the risks to your brain and its circulation, that there will be problems with providing it with the nutrition and oxygen that those nerve cells need. So you want to keep your blood pressure first and foremost in a normal range, and you can do that by checking it frequently, once a month or several times a month if you have problems with your blood pressure. You also want to maintain a normal weight. By maintaining a normal weight and exercising, you're probably going to have a normal cholesterol level, and that would minimize the chances that you would have plaque building up on the carotid arteries, and That in turn minimizes the chances of plaque breaking off, going up to your brain and causing a blockage. So, and that's essentially it. Again, for each of these segments of the arterial and venous system, I'm going to take kind of focused segments and present some pictures of that vasculature, and in general some main points of some effects on those systems if you have disease taking place in the vasculature. And that's it. And you have a great day.